Thank you for the opportunity to be a part of this conference and also conduct the work for the VOPD project. As said, my presentation will be about the review, but first I will say a few words about the Nordic Research Network, Health and Welfare Technology. And as said, a first initiative was taken in the spring of 2018, and I contacted Bengt Andersson at the Nordic Welfare Center, and together we sent an invitation to research colleges in Finland, Norway, Denmark, and we're also looking for Icelandic partners. And we had a first meeting in May the same year, and we wrote a statement paper which included the aim of the network, which is to consolidate knowledge, research, higher education, and experiences in the field of health and welfare technology, with a user perspective including the end users, relatives, and staffs working in the welfare sector. And as said, today we have about 50 members. We are happy to be under the umbrella of the Nordic Welfare Center, and we have some funding from Forte to build the network. We have created a core team with more active members working with the program and different activities. We have members, we have an open web page and also a website for the members. This far, 2021, with all the challenges we are during the pandemic, we have arranged digital seminars. We are planning for activities referring to the Nordic Councils of Ministers program in Finland. We are planning for writing research proposals. We have different collaboration, and we also have funding from Academy of Finland in one project in the area. Okay, the review. The network received an assignment from the VOPD project, and the work was asked to compile Nordic research on the effects of welfare technology, distance spanning solutions in the daily life of the users. And the frame was that it should be Nordic scientific publication and grey literature, and it should include a minimum of 10 publications. The aim of the review was to explore Nordic research of the effects of welfare technology from a Nordic perspective. And the questions were, what is the state of the art in the subject? What do we know from a research perspective about the area? I was the one from the network who had the possibility to do the work, so I have conducted this review. And to start with, the concept of welfare technology is a bit challenging to study, since it is an area under constructions. There are a mismatch of definitions in the area, and there is also a limitation in that welfare technology is a Nordic concept. It's not used so much outside the Nordic area. And this report or review uses the VOPD definition, which is based on the conceptualizations of welfare technology due to its functions of distance treatment, distance monitoring, distance meetings, and new digital services. And I also would add that there are expectations and aims of welfare technology, what effects it's expected to give. And some of them is that it's the welfare technology should enhance safety and security, improve social contacts, improve health and activity. Furthermore, it's also expected to improve public health care and social care in a cost-effective manner, and also to improve work environment and patient participation and independence in daily life. Welfare technology is also considered to be essential for prolonged independent, healthier, and more active life. And there are many examples of what you could define as welfare technology. They could be labeled under the concepts of telecare, telemedicine, e-health, e-rehabilitation, e-home care, and like. And some examples are devices like automatic toilets, eating robots, social robots, GPS trackers, tablets for communication, smartphones, safety alarms, and many others. And another way to kind of frame the concept is also to talk about it as technology used outside the hospital. So it does not include, for example, advanced medical technology as used, for example, in intensive care at the hospital. The data search were conducted, supported by an experienced librarian, and we used a bunch of terms looking for the literature. And we also use them in combination with the concepts of daily life, everyday life, quality of life, and activities of daily living. We use the traditional databases as CINAHL, Web of Science, and PubMed. And when we were looking for the gray literature, we used the national databases which indexing this kind of literature, but also DART Europe and Google Scholar. The inclusion process and the data set was conducted in different steps. In the first search, we were a bit surprised to find actually nearly 1,000 different hits in the area. We thought that it should be a more limited amount of hits in this area. And we limited the search to have a publication from 2015 and later, and that resulted in 656. And then we read all the titles and included titles indicating a study exploring the effects of welfare technology. And that resulted in 85 publication. And then we read all the abstracts and included the studies which actually explored effects on welfare technology. And that resulted in 40 publications, which serve as the data set for the review. And you can see the representation of the Nordic countries in table 1 on your screen. And as you see, there are less representation from Finland and Iceland, and that refers to my limitation in not reading Finnish and Icelandic languages. Looking into the different publications, they were categorized due to the definition of welfare technology in the VOPD project, but also in combination. So it resulted in 9 categories, and I added a new one covering review studies. And the data sets consist of peer review, scientific journals, publications, also reports, PhD, licentiate, and master dissertations. And looking at the target groups, they are a bit diverse. They include older adults, older people, but also in a majority patients with different medical conditions. But there are also studies representing the target group of relatives, staff, and healthcare and social care providers' perspectives. The contexts represented are home care, home health care, dementia care, rehabilitation, mental health care, and palliative care. But then again, it's outpatients who are in the data set. And some of the studies are also double or triply categorized due to their content covers more than one of the categories. And I would say that referring to the introduction video, many of the patient stories there confirmed the findings in the review. And you see an example how every selected publication is presented in the report. Looking into the findings, I will show you some examples, a selection of examples in 3 slides. And just to give you a brief view of it, for example, when looking into publication about distance monitoring, the studies show that it gives better sleep, increased safety and security, increased independency, activity, and quality of life. And more examples here. Distance treatment gives improved independency, better effectiveness, increased physical activity, and health literacy. And looking on a more abstract level on these findings, it could be seen that it shows a trend of technology optimism. It's very positive findings in actually a majority of these findings. And I will come back to that a bit later. Looking into the few review studies in the area, it shows that welfare technology has the possibility to increase self-health monitoring, improve quality of life, and make healthcare services more user-friendly. Welfare technology also offers reduced medical errors, improved health communication, and other advantages. Though the review studies also showed some drawbacks. For example, there are financial issues that could be problematic. The welfare technology is quite expensive these days. We also have some challenges in adoption to policies, laws, regulation, and organizational structures. And there is a lack of evaluation of the efficiency and outcomes of using welfare technology in larger studies. There are still quite small studies, small data sets, small amount of participation in these studies. So some reflections. There actually exists quite a lot research about effects of welfare technology in research produced in the Nordic countries. Though there are quite small studies, and you could always discuss this concept of evidence in the area of research, and it could be discussed in different matter. But if we take the point of departure in the perspective of the medical evidence, I would say that the majority of the studies are on the lower levels of the evidence hierarchy. They are on the light blue and the green levels. So based on that, I would say that we need larger studies to support healthcare and social care to be supported by research-based knowledge, and we need to measure the effects better in larger studies. Though there is a challenge that we lack of instruments, validated instrument measuring these expected effects of independency, safety and security, health, quality of life, participation and activity. And I would also say that it is a kind of a technology optimism in the data set. And when looking into that in the data set, I could see that the participants in the study have by themselves chosen to be a part of this study. So they come into the research with a positive attitude about using this technology. So the research might not represent populations. It represents people who are interested and have a positive attitude of using this kind of technology. Looking into the studies, they are mainly taking point on departure in the Western culture where independency is a highly cultured value. I couldn't see any of the study having a more multicultural perspective, for example, looking into family traditions of care. Though I think it would be beneficial to collaborate more from the Nordic perspective. We have similar welfare systems. So if we conduct this research work together, we could produce more as a service for the Nordic countries about the health and social care. And especially when you're looking at the research in rural areas where it could be a challenge to find sufficient amount of participants, it would be a possibility to collaborate in the rural areas of the Nordic countries. So finally, this is an interdisciplinary research area with great potential to contribute to the Nordic health and social care with research results, and also with the higher education, which could be referred to that. And we need to develop better instruments to serve this, and also include the financial part. And we also need larger studies. And I would say, taking the perspective from the research network, that we are ready to serve. So we would like to be a part of this and serve the Nordic countries. So thank you. This is my email address if you have any questions. The review, the report is to be found on this link. And if you want to know more about the Nordic Research Network, there's also a link to this. Thank you.